This lecture will cover the cestodes, which are also referred to as flatworms. And so with these organisms, they mature. When they mature, they contain male and female organs, so they are actually hermaphrodites. And then here's just some terms that if they're referred to, just so you can kind of know when it refers to the structure of the actual tapeworm itself. Diphyllobothrium lathum. This is also known as the freshwater broadfish tapeworm. And so this is the largest human tapeworm. Fish are the reservoir host, and then humans become the definitive host through ingestion of the fish. So this organism does cause mild gastrointestinal symptoms, and it can also cause pernicious anemia. And so this is because of pernicious anemia is also known as macrocytic anemia, but this is because of the B12 deficiency that it causes. And so it can be associated with abdominal pain, weight loss, and then of course the diagnosis is based on the eggs or the proglottids that will break off into the feces. So you can imagine a tapeworm kind of looking like tape, and those little segments will actually break off and are visible in the feces. And so the eggs can be an ovoid type shape or piculated, yellow to brown, and then the proglottids are wider, and they are a little bit longer with a rosette shaped central uterus. And the prevention of contracting this organism would be to avoid eating raw fish. And so here are just some images of this organism. So you can see this egg. It's a pretty large egg. And I think there's some images a little bit later that kind of compares some of these eggs and organisms because they do look so similar. But it's going to be based mostly off of the appearance of this egg. Diphyllobium caninum. This is known as the cat or the dog tapeworm. And so the proglottids do have a little distinctive characteristic to them. They say they can appear as grains of rice, in the stool, or like a cucumber seed. Humans can get the tapeworm through accidental ingestion of fleas, but cats and dogs are typically who's going to be infected with it, and then the host would become accidentally infected by being exposed to the larvae from infected animals. Most time this infection is going to be seen in children. And so what it will do is cause a mild intestinal disturbance, and then you can actually get that organism or those egg packs, I guess is what they call them, and you'll see a picture of that shortly, where you actually find those in the stool. And so prevention would be just to kind of control the fleas within your household pets.
Diphyllobium caninum.
And so with this organism, what you're looking for is those egg packets, so you can kind of see where they're kind of like grouped together with those eggs inside of that one big pouch there. And the organisms can kind of look similar, but here at the top of this organism, the head of this organism, it has these little suckers that kind of go around the top or the head of this organism, so that allows them to have attachment to the host cell. Ananoplis nana, also is known as the dwarf tapeworm. So this is a person-to-person transmission. With this organism that does have symptoms that are similar to a pinworm infection, but you can have like a light asymptomatic infection, or you can have a heavy worm burden that can cause abdominal pain, diarrhea, headaches, dizziness, and also as well as itchy bottom. But this organism is diagnosed based on eggs in the stool. And so with this one, it looks a little bit different, but what you get is you get these little hooklets inside of this organism, so you can kind of see where it looks like little hooks inside of it, but it does kind of have like a thicker outside shell, and then you have the organism within here within those little hooks. And so to prevent this organism, it would be, you know, proper hygiene to prevent the spread of this organism. Hymenopilus dominia is known as the rat tapeworm, and this infection is rare in humans, but it does happen, and it can happen with accidental ingesting of the eggs, and this can be like through contaminated grain that's usually contaminated from like fleas or grain beetle. And so with this one, it can have a very mild symptoms, and again, this is one that can kind of self-eliminate, where that tapeworm just kind of let go and it's just spontaneous release. But it can also be diagnosed on the eggs in the feces. And so with these eggs, and just like the previous one, what you're looking at is like an iodine type stain or wet prep type stain. And so where the other cell wall was really, really thick, you had a lot of filling in this area. This one's a little bit thinner. But again, you can kind of see those little hooklets here. This one's a little bit better image than that last one. And so with this one, you don't have this little filled in area here. The cell wall is a little thick. And again, you're looking at those for those hooklets. So controlling your mice, rats, that flea population, good hygiene, sanitation will help prevent this infection or from this organism contaminating anything that might be ingested. Taenia solium, this is referred to as the pork tapeworm. So that means the pigs are the intermediate hosts and then humans are the definitive hosts. And so this can cause intestinal infections with abdominal pain, diarrhea. And then with this infection, you know, some patients can be asymptomatic again with this one, but they can experience weight loss with this infection. It can also cause an extraintestinal infection with where the larvae actually infect the tissue. And so diagnosis would be based on those segments of that tapeworm that they're seeing, or with eggs. And so with the eggs, you get these very round or to oval shape eggs that will have a very thick outer shell. So you can kind of see that very thick outer shell here. It's kind of got like a little distinctive appearance to it. And then you're also looking for like inside of it, you get these little aquaspheres. So you see like these little inclusions here inside the cell within this egg. And of course, prevention pretty much with everything else is good hygiene and making sure that that pork is thoroughly cooked. And so here you can see the skull wax of this organism, and you got those little suckers at the tip where it will actually attach with a sucking type mechanism. Taenia saginata is the beef tapeworm. So the life cycle as far as it goes is very similar to the previous organism. Cattle is the intermediate host. You can look for those proglottids in the stool sample as well as those eggs. And you can see that egg is very similar in appearance to the previous. And of course, prevention would be making sure that you don't have any of those cysts in that beef and to cook it very thoroughly. The infection with this organism, again, it can be asymptomatic, but abdominal pain, diarrhea, weight loss, and then those proglottids or those eggs being present in that stool sample. And so again, here you can see the suckers on the end. And this one looks a little bit different because of the fact that the head is a little bit more rounded. And with it, you know, the suckers are more towards the side, and then you have this area here in which it can attach, and it's got all those little prongs or hooklets there. So here's just a comparison of the eggs, which helps differentiate them, just kind of a side-by-side view. You know, with your tinea, you're looking at that thick wall with those hooklets in the center. Your Hymenoples, so those are going to be differentiated, again, based on that cell wall. So you've got this thicker clearing here, where you've got the organism on the inside of the shell developing, where this it's got like a thinner layer here. It's not as thick. Your Diphyllolatum, you've got this little opening up top here. You can see this kind of filled in area here. Your Icanium, where you've got this thin outside edge, so it's a little different than this outside edge. It's a little thicker, plus it's a smaller organism. Again, you can see those little hooklets here. And then of course this would be the packet. This is probably more common what you're going to see. This would be the individual egg versus the actual packet of the organism. Here you've got a comparison of the proglottids with that sexual reproduction section, and then also the head of the organism. So this is that little sucker right here where it attaches, versus the shape of these two organisms here, where you got those little hooklets attachments on the end for the solium versus the saginata, where the head is a little bit more flattened off here on the tip, so you don't have those prominent attachments at the end. The suckers kind of circulate around the tip of it. This one kind of protrudes out where it attaches, so you can see they all kind of look a little bit different there. With your tissue cestodes, these larvae do not reach an adult type stage within the humans. The eggs are accidentally ingested, and then the larvae deposit in various organs and tissue. So the tinea solium can, also cause, not only can it cause an intestinal infection, but it can also cause other infections. So what can happen is the larval form will actually invade the central nervous system, the eyes, or other tissue. So this can be seen with like immigrants. And once that organism has kind of invaded the intestinal wall, then it can kind of mature and migrate through the tissue throughout the body. And so the most severe form of this infection would be when it happens within the central nervous system. And then if it does reach the eye, then the organism would have to be removed in order to prevent any sort of blindness that can happen. And so again, you're looking for those eggs to see, identify this organism, or you could need something like tissue biopsy or CT or something to help identify it within the soft tissues. Echinococcus granulosus is the smallest of the tapeworms, so the definitive host is the canine. But it also can infect sheep, cattle, moose, humans. And so this one also, like the others, it's accidentally ingested after being in close contact with the definitive or intermediate host. And so again, it does have a life cycle that it does go through, in which it can actually infect the human, and so the human would be the accidental host. And then from there, it could actually cause a hydatid disease, where it forms a hydatid cyst that can happen within the lung, the liver, the brain. And so this type of infection can cause a lot of complication with like lung symptoms of like cough and pain. That fluid can actually leak out, and then it can cause an allergic type reaction in the eosinophilia, where you have an increased amount of eosinophils and so diagnosis would need to be done to detect this organism. So if the patient does develop the hydatid disease, then that cyst forming is going to give a granulomous type cyst to it that would be inside of that cyst from that fluid. And so it can cause complications like a bile duct complications, obstruction, which can obstruct the flow of the bile from the liver. And so again, you're looking for things like the eosinophilia, you're looking for that cyst on imaging. There are tests that can be done, serological tests, that can help detect it. And so prevention would be to avoid contact with any sort of infected animal. And so here you can kind of see those granulomatous type cysts with those eggs in these images here. Echinococcus multiloculis will cause the alveolar hydatid disease, and so this is fatal. And so with this disease, the cyst lacks the laminated membrane, and it develops connected chambers with very little fluid, and so this will form actually primarily in the liver, and then it can actually metastasize to the lung or to the brain. And so it's often mistaken for like a hepatic sarcoma, but it can be diagnosed again with CT scans, MRI, and you're looking in that soft tissue. And so prevention would include controlling your rodent population, good hygiene, deworming, household pets, just to prevent that possible exposure to this organism. Your definitive host or your fox coyotes, dogs, and your intermediate host would be rodents.